Thanks for that, Katie. Look, folks, flu season is in full swing. We all know it. We feel it. And Dr. Mario Pulido, with the Chief Medical Officer for Ascension St. Vincent, is here with us this morning. Dr. Pulido, we have got to talk about what is going on. Within our newsroom alone, I've got to tell you, it feels like every week someone is calling out sick. I'm going to give them a little bit of inside baseball. You were supposed to be with us last week. You got sick yourself.
Yes.
What is going on? It feels like this season in particular, the flu is really active.
It does seem that way. I know from the acute care perspective, we are seeing a lot of presentations to the hospital, so individuals are coming, a lot more acute with these presentations. It is also a very active viral season. Not only is it flu season, it's RSV season. There's also a good spread of norovirus, which is a GI bug that's spreading throughout not only the Florida community, but really throughout the country. We saw a spike start to go up around December, and that spike has really maintained itself throughout January.
Are we in the peak of things right now? Is this the peak of season?
It is the peak of season. It starts around October, but like I said, December, January, really into February is kind of really the peak, the traditional peak around this. We're seeing that same type of surge this year, and it goes into the early spring. So March, April is kind of when it really starts to settle down and you start to see that incidence go down.
You know, for those of us with young kids, students in school, we are definitely concerned. It's spreading around the school system as well. Are you seeing that? We
are, and really the best practice there is just to continue to maintain a sterile technique as far as hand washing, good appropriate hygiene. As far as the flu is related, anyone above the age of 6 months is really indicated for the vaccine, and the best time to get it is now. So if you haven't already obtained it this year, go ahead and think about your risk factors, your family, your kids, and the different elements that you're exposed to. And if you have, qualifiers for the vaccine, it's really a good consideration to go ahead and get that.
I'm glad you mentioned that, because you hear time and time again, wash your hands. You think, oh, that's so basic, but it's so important. It takes something that simple to do it, to keep yourself safe.
It's incredible. The flu is really air droplets, so you're going to talk about, kind of the airborne transmission of this, but those air droplets eventually land on surfaces that, we can wipe and we can sterilize. The norovirus is really contact precaution. So again, the surfaces, the doorknobs, hand washing, it's incredible. That's really the vector of how we go person to person when that spread occurs.
And once we're actually infected, we have the issue, we have to deal with it. What should we do? Any suggestions?
So viral illnesses are tricky. There's really not a lot that can be done from a treatment perspective. There are antiviruses specifically for influenza, but the caveat there is they really should be taken within the first 48 hours of onset of symptoms. So if you have symptoms, you have the respiratory picture, talk to your doctor. If you have the qualifiers, they're going to likely go ahead and promote you being on Tamiflu, which is the antivirus for this. Norovirus and others, really the important consideration there is because there's a lot of GI manifestation, nausea, vomiting, even diarrhea. It's a fluid management. So you want to make sure that you stay hydrated, get plenty of fluids in, and rest. When the body asks for rest, just pay attention to it, get some rest, and of course control your fevers. Anything around 101 or greater, you want to start to treat that with some type of NSAID or Tylenol to make sure you don't get much higher than 101.
Great advice there. Lots of water, get some rest if you can. For those of us who are just way too busy, it's hard, but you make it happen. As I mentioned, Katie and I have small kids. We were talking about that, but you heard him, Katie. Get ready. It's coming.
Don't I know it. Thank you so much.